I'm Samantha Olds-Fry, CEO of the Illinois Association of Medicaid Health Plans, and this is SamSays, a podcast series focused on Illinois Medicaid managed care.
Hello, I'm Durandal Beverly with the Gemini Group, and welcome to SamSays. On today's episode, we sit down with Soccoro Romero, registered nurse case manager of Aetna Better Health of Illinois, to discuss care coordination in the third part of our three-part care coordination series on SamSays, focusing on the value of making connections. But before we do that, let me welcome our host, the Sam in SamSays, Samantha Olds-Fry, CEO of I'm Hip. Sam, how are you today?
I'm great. How are you, Durandal?
Doing well. Before we started the show, you mentioned that session is almost wrapping up. I think you have about a week and a half left. How's it treating you so far?
You know, this is the stretch that always sort of both makes me very excited for how we're going to strengthen the Medicaid program and pretty darn stressed with that final stretch and sort of buttoning everything up and making sure that we can implement everything and answer all of the questions. So right in the thick of it.
We're almost there. There's a light at the end of the tunnel for you, so we're almost there. We have a great show lined up today, great conversation. So what we're going to do is we're going to now bring in today's guest, again, Soccoro Romero of Aetna Better Health of Illinois. Soccoro, welcome to SamSays. How are you today?
I'm good, thank you. Thank you for inviting me, and thank you for the opportunity.
So we're excited again to dive into today's conversation on the critical role of care coordination. So as we do that, can you kind of level set for our listeners and tell us a little bit more about Aetna Better Health of Illinois and your approach to care coordination?
Yes, Aetna Better Health of Illinois is a health plan that provides quality care for services to our most vulnerable population. Aetna Managed Care Services has a unique approach. We use tools, we use expertise to improve member health outcomes. We team up with providers, DME companies, members' family, and other resources and approach members' needs as a whole. We look at the whole person, spirit, body, and mind.
I love that, Soccoro, and that's so important because I think oftentimes when we think of healthcare, we think of sort of just that clinical component and just sort of that what's happening physically. And I love that Aetna takes a step back and says it's really important for us to look at the whole person. How are they feeling? How are they doing? Mm-hmm. And what are their goals? And it's just critical, I think, in order to be successful. Especially in the Medicaid program, as we know, social determinants of health are such a big driver in our health outcomes.
Oh, yes. Mm-hmm. Yes, it's correct.
And you talked a bit about partnering with providers. And you guys, I know at Aetna, one of my favorite things that you guys do is really innovative partnerships with providers, facilitate connections in order to address the members' needs. What, in doing that, what are some of the lessons you've learned while working with providers? And one thing I want to think about specifically is, around discharge planning, because that's something that we hear a lot about is in discharge planning, that's such a critical time. Somebody's leaving a hospital and are they supported in their home? Are they supported in the community? And what does that look like from your perspective, Soccoro?
Well, I have learned many lessons. I tell you, I have learned many lessons. But the first and foremost important, I think, that all the providers, members, and family, we want to accomplish the same goal. We want to get what is best for the members' health, the best outcome, the best goal. So some of the factors that I have accomplished throughout the years are language barrier, because I'm a Spanish speaking, so I know what that entitles, education and culture. A lot of our members have a very low educational background, and those are barriers that we encounter during discharge. So as a CM, I serve as an advocate to minimize those barriers. I improve communication. I alert the members' needs to the provider, and I explain to the members things that they don't understand. And more of their base understanding.
I love that word you used, advocate. And you're advocating for them. You're making sure that they are understanding what a busy hospital staff person is trying to say to them, a clinician, and maybe, like you said, there are so many various barriers, and you're removing them step by step, one by one, making sure that the member understands the plan and is comfortable along the way.
Yes, that is very important.
So we're lessons learned. We've talked about that. And I love also what you said around the goal is the same. Everybody, the provider, the member, the health plan, the care manager, all the same. Everybody wants a successful discharge, wants improved health outcomes. Everybody's on the same page. But can you talk a little bit about like what successful care coordination looks like and requires during that discharge planning? Because it sounds really good, right? But I bet it's a little bit more complicated as you're going through it.
Well, I think to really have a really successful care coordination during discharge planning, everything starts at admission. If it requires prompt communication with the member, the family, the hospital staff, and to know what the members' challenges, needs, and access to services they require. What is their barrier to get services? What is their barrier to medications? Not able to attend their follow-up appointments, or even to have a PCP. It is the perfect time, I think, when they are in admission, when they're in the hospital, to monitor their progress and their communicate with the other team members and to engage them and build trust between the member, the family, the doctors, and the case manager.
Absolutely. And I like how you outlined, like, this doesn't begin the day of discharge. That's too late.
No,
because it's too time, constrained. It's too pressing. You've got to begin at the beginning.
Exactly.
And so I understand now how it sort of works conceptually. Do you have like a member story or some examples about sort of the value of care coordination, like what success looks like from a human level?
Yes. Yes. Successful coordination starts with getting the members and family trust. So I do have a story, and it's a very nice story. I have a young guy. He's probably 40 something. He was in a pedestrian vehicle accident, had multiple injuries, broken bones. He was in a coma for a couple of weeks, had a trach, G2, was not able to communicate his needs. He received intensive rehab for probably 3 weeks to a month at Schwab Hospital. And then he was sent to a skilled nursing facility. So our goal with his daughter in case management and providers was for him to go back into the community. So we work with the whole interdisciplinary team, therapy, rehab doctors, skilled nursing facility, social workers, and it was a constant communication. We use all ways of communications. We use email, we use Skype, we use phone calls, and we are getting that member back to baseline. He's able to eat alone now. He doesn't have a trach anymore. He doesn't use oxygen. He's up in the wheelchair. He is walking with a walker. And probably early next year, he's going to go back into the community. So as a case manager, I provided all the DM equipment that they needed. I made all the appointments, provided transportation services. So I'm really happy. He's following commands, he's alert, he's speaking, he's eating. And that is a wonderful, I think, outcome for someone as young as he is, and for serving as an advocate for him. This is where we're going to get. He's going to go back into the community with some help, but he's going to go back into the community.
And that's so great. I mean, care coordination, you use that term healing, like bringing about that healing. And I think from a human perspective too, is this poor man is just going through completely unexpected situation, and really went from a healthy life, no need for medical intervention, to being reliant on, durable medical equipment and so much, and the hardship that had to play on him. And
Yes.
so for you to be in his corner, sort of cheering him on, getting him the things that he needs so that he can continue to progress, and removing those barriers, is really is life changing. And for this person, he's going to be able to go back to his home, or to the community, out of this nursing facility, where he wants to be.
Yes. He does not. He keeps mentioning that he does not want to be on a skilled nursing, and that he doesn't know what he is doing there. So he did lose a little bit of his memories, but the daughter and the nurses are working and reminding him that he will be going back.
And what a hopeful thing to hold on to too, right? Like, this isn't like you are on a path to be able to go back into the community. That's got to be motivating as well.
Yes.
I just want to thank you for your compassion and advocacy for this man, but also for all of the members that you're serving. So as we talk about, the utilization of MCOs, Soccoro, you're an RN care coordinator. Like, this is what care coordination looks like. It is people with just wonderful compassion and an ability to advocate for our members, treat the totality of of the person, improving lives of Illinois communities. And given the last year, how do you see care coordination evolving? Obviously you are already doing great things. You're helping people, you're helping them reach their goals, but how do you see it evolving as we move forward? And what keeps you going at what must be just a challenging role, an important but challenging role?
Well, I have been in the healthcare for like almost 30 years, in the case management for about 6 years. And I believe care coordination or case management is here to stay. I have seen it growing. I have seen it evolving, using innovations, using new programs, new strategies to deliver that high quality and high value healthcare, like getting equipment into patients' home to be able to monitor from a physician office. That is an excellent, innovation that we are using at this time, and I know it's going to grow more. So innovations have only opened other ways to guide, to link, and to integrate the physical and the behavioral health to our members. I think it has bring us more doors to provide better health care.
Absolutely. And using that technology to sort of bridge between appointments, to sort of monitor, and to make sure that member knows, you've got support
Yes.
this entire time. Now, the last question I have is sort of what keeps you going? You've been in this for 30 years. You've been a care coordinator for 6 years. It's got to be rewarding, but it's got to be challenging. So what keeps you going and passionate about this work?
What it keeps me going is the love that I have to help members. I truly going to confess that when I came into the nursing field, it was my mother's decision. It wasn't my decision. I do believe in a higher spiritual, which is God, and He brought me to this point, and He had me here for a reason. So I love what I do. I love to see members going home, getting better, being healthy, being positive. It is wonderful to see them succeed in life. Not only, physically feeling better, but spiritually and emotionally, because we all have our own beliefs, but we all want to be better. We all want to feel better. We all, want to just be better and feel better. So.
Oh, I love that. And I'm just what I heard is really, it's about you helping people. It's about you helping them find their wellness, their best self. And I'm so grateful for your mom pushing you into this field. You didn't want to be in it.
Didn't want to be in it, no.
The amount of people you've helped and that you've helped bring about wellness, that you've supported, is amazing. And so from the bottom of my heart, I just want to thank you for making these people's lives so much better and sharing so much of your energy and self with them, and being sort of that calm for them in the middle of a lot of storms.
It could be stressful, but it's also rewarding. It is very rewarding. And that's what it keeps me going, because it is worth it.
It is.
Okay, that is beautiful. And I think that's a perfect spot, I think, to end it. Soccoro, thank you so much for taking time to join us today. Thank you and Aetna. We'd love to have you come back in the future if you don't mind. We'd love to keep the conversation rolling. And if you'd be willing, we'd love to have you back on Sam Says if you don't mind.
Thank you for the invitation. I do appreciate it.
All right.
And I love to be here.
We appreciate that. Sam, before we close out, that was a wonderful, wonderful conversation. Anything that you learned or anything that's going to stick with you, post the conversation you had with Soccoro?
Absolutely. I mean, I think in the middle of all that is legislative session for us, to be reminded of why we do this, which is to continue to support people like Soccoro, who are coordinating care for our most vulnerable, doing it with such passion, with such heart, doing it for all the right reasons, because they want to bring about wellness and they want to improve people's lives. It's buoying, really. And I'm just so grateful for the conversation and for the uplifting discussion, but then also just being reminded that, she's out there doing just God's work.
Absolutely. Absolutely. Beautiful, beautiful way to sum that up. If you like what you've heard today, we encourage you to visit the I'm Hip website at imhip.net. That's IAMHP.net to learn more about what the association is doing and to listen to other interesting podcasts like this one today. We also encourage you to like and follow us on Facebook, LinkedIn, and Twitter. And if you're interested in becoming a trusted partner, I encourage you to reach out to IMHIP's Chief Operating Officer, Elena Kennedy, or visit the website again at imhip.net. On behalf of Sam and the wonderful team at the association, again, I'm Durandal Beverly with the Gemini Group. Thank you for tuning in to another episode of Sam Says. Stay safe, and we'll talk to you soon.